I'm Tyler Murray, nurse practitioner here at Summit Brain and Spine. Today we're going to talk about considerations when we're looking at recommending surgery. There are a few things that we think help provide optimal patient outcomes when we are considering surgical intervention. The first thing would be that we do take into consideration a person's body mass index. Body mass index is a calculation that's based upon a person's height and weight. An individual with a BMI score over 40 may have increased risk of postoperative complications. Therefore, we really try to help individuals understand this and also provide resources to them to help them get their BMI closer to the 40 range or below prior to undergoing surgery. One way in which we do this is we help patients collaborate with our registered dietitian, Dr. Bowden, who can talk to you about dietary modifications that can help aid in your weight loss. The other thing that we look at is those individuals that have been diagnosed with diabetes. We know that elevated blood sugars can increase your risk of postoperative complications such as infection and delayed healing. We do recommend that your A1C be 7 or less, again, at the time of surgery. And then the other thing that we would want to take into consideration is if you are a smoker or you consume nicotine, that we have you abstain from smoking or consuming nicotine approximately 3 weeks prior to surgery, and you may be asked to provide a blood panel showing that you do not have any nicotine metabolites in your system right before surgery. And then we would ask that you refrain from smoking or, again, taking in nicotine consumption up to 3 weeks after the operation. And then the other thing that we would want to take into consideration is if you're on high amounts of opioids, that can also affect the way we manage you postoperatively. So we measure opioid use by morphine milliequivalents, and those that are over 40 morphine milliequivalents per day may be asked to work with either their pain physician, or we have resources here that could also help you lower your opioid use prior to surgery. All of this is in an effort to help improve surgical outcomes. If you have further questions regarding this, please bring it up at the time of the appointment, and we will do our best to help facilitate getting you ready and optimized for surgery.